Abductor digiti minimi is basically the exact same thing. The only difference is on this one, we're asking the patient to abduct. Okay, so they abduct their pinky, they bring it outward, and you're giving your resistance, actually on this one, you're giving your resistance on the middle phalanx. So against the side of the middle phalanx for abductor digiti minimi. Mid-phalanx is where you're providing resistance, and you're going into the direction of abduction. Let's just make sure we understand the terminology here. When we talk about the hand, abduction is a sagittal plane motion. It's different than it is for the rest of the body. In the shoulder, for example, abduction is a frontal plane motion, flexion is a sagittal plane motion. In the hand, abduction is a sagittal plane motion. Okay, that's really important that you guys know that, because that'll help you position your patient, correctly. So if we are doing abductor pollicis longus, the abductor pollicis longus basically attaches at the base of the first metacarpal. Okay, so our resistance is going to be on the distal aspect of that first metacarpal, toward the direction of adduction, down toward the table essentially. So I lift it up and I just say hold, hold, hold. This first metacarpal here, I'm pushing downward. Okay. This one crosses that MCP joint. Okay, so or it crosses the IP joint, I should say. I guess you call it the MCP joint. This is your IP, this is your MCP. So for the brevis, we are just distal to the MCP joint. So the difference is this. In the thumb, we're testing the longus on this side of the metacarpal, and to test the brevis, we're testing on this side. Okay, now typically you would think the longus goes farther, like the profundus would go farther. With the thumb, that's not the case, it's the opposite. The longus it just goes way up the arm, but it attaches here. The brevis crosses this MCP joint of the thumb. So this is where we are for the brevis, this is where we are for the longus. It's the exact same hand position. You ask the patient to bring your thumb up toward the ceiling for me, hold here, hold, 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 hold. That's brevis, and this is longus right there. It's just that much of a finger width away. And let's do the two other flexors, flexor pollicis brevis and flexor pollicis longus. These ones are easier to remember. So when we talk about flexion, so if I just say I want you to kind of flex your thumb joint here, the longus is here, the brevis is here. So to test the brevis, it's kind of like the brevis is the equivalent of the superficialis, the flexor digitorum superficialis. The longus is the equivalent of the flexor digitorum profundus. So for the brevis, I'm short. For the longus, I go long. Okay? So if I can have your thumb here, what I'd like you to do is just bend your thumb like so. Hold it and don't only push it outward. Hold, 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 hold. That's brevis here, and longus is this one here. Hold, 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 hold. And always try to give your stabilization as to the joint proximal to the one that you're testing. So ideally, go ahead and flex your thumb. I'm stabilizing her proximal phalanx while she's flexing here. And here, I'm stabilizing the metacarpal while she flexes there. All right? This is brevis. This is long.